So once I have everything set up for me, this hand is going to become, I have the drape, I put the drape, as you can see for the male it's easy, you put the drape and there's no problem. What is this hand going to become? Not steady. I retract the foreskin all the way down. I just paint one from the middle of me from the center out, 2 and 3. Sometimes you find around this area you find a lot of smegma that you need to wash out, okay? Because then it's going to contaminate it. How I hold the penis is like this, because you need to hold the penis in a way that when you need it to straighten it up, you can do it. If you grab the penis like this, it's going to be slippery, it's going to slip away, okay? So I found this very useful, this way of holding it, okay? Because if you need to put more pressure, you can put more pressure. It's not going to hurt. You won't hurt the patient won't feel anything. So once I hold it like this, I have to insert the catheter, I have my little loop. I have to be very generous with lubrication because this one is going to go down really.
It's going to take a mile an hour.
Yeah. Once I insert, as I go through the first, I try not to touch anything else. Once I insert, I feel like I'm in a porno movie. remember, for men, it's very useful. It's very useful to do this movement of screwing one way or the other one. Okay. And this is,
and that just capped off this class.
Yeah, because it's the only way. Once you hit,
What did I learn in class?
don't prostate, but once you hit,
That's on video
hold
too.
it.
This really has to go on YouTube.
Well, this is very slippery. I like to have 4x4s on hand because sometimes you need to clean the gloves. That's the other thing. I'm fanatic
So
about
you
this.
can open that and have that all prepared when you start, you know.
Yeah,
The whole thing is
I
being
always
prepared.
open it 4x4 for
Yeah.
just in case. So the penis has to be up. If you doesn't go, you try to straighten up to pull. You're not going to lift the patient like this.
You do that and you're going to get kicked.
And the patient, it doesn't hurt. Believe me, if you do like this, it doesn't hurt. So you just go down. Imagine it's down. Some policies said that for males, because the length of the urethra is significant for males, you have to go, no matter whether you have urine or not, you have to go up to here. And then, yeah. And then bifurcation. I think it's too much.
Yeah.
The risk when you do this, if the catheter coils inside the bladder, you can end up with a knot. And if you have a knot, then who is going to remove it? You need a surgeon who puts a catheter and cut all that stuff in there. So imagine we have urine, and when I have urine, what do I do?
Advance it 2 inches.
2 inches more, and then switch hands. Dirty hands hold everything. This one in a male is going to be closer. Dirty hand holds everything. This hand, I use it to put my water to inflate it.
You're blown.
Urine flowing.
Yeah, the urine is flowing.
We need to inflate the balloon first, right?
No, the urine is flowing. When the urine flows, you go 2 inches more. So you know for sure that the balloon is outside the urethra.
Yeah, after 3 inches.
After that, you go. Every time you go in, you have to have a sterile hand. Once you are sure you don't go in anymore, you can switch hands because you're not going to touch anything else anymore. Okay, this is as dirty as everything else is going to be. And then you inflate your balloon, and then you pull a little bit to see that it's in place, and the same procedure. With the male, you have to have the precautions to clean with whatever cleaning agent you have for washing, to clean all the povidone from the glands because it will mess up everything. Females is more moist, doesn't stick as much. And what else? Tape it here on the same story.
Can I add something?
Sure.
Okay. You're going to see different people use different techniques. Doesn't mean it's right or wrong. Bottom line, you have to remember that this is a sterile procedure, all right? You did the sterile dressing changes. You all know what sterile is and what would contaminate. So always remember sterile field, okay? But like you'll see, you know, like somebody mentioned to me in some demonstration she had seen, you know, where they kept this syringe attached here,
Oh,
so
well,
they could
yes,
inflate. That's just a technique. It doesn't have to be. If you find that that's easier, by all means, you do that. But just the important thing is sterile, 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 okay? And making sure that they're cleaned properly and that holding onto the catheter toward the tip, like Dr. Parrish showed you, is really important. You know, like you showed how floppy they
Yeah,
are.
if you grab the catheter from here, if you say, oh, I'm going to insert all this, you grab from here, you cannot do anything.
Yeah.
The same as you are progressing, imagine this is, as you are progressing, you have to progress very close to the meatus, because if you do like this, it will bend.
Yeah, see, you
Okay,
just have
this is stiff enough for you to progress. I think that when you do this movement, that you go around like a screwdriver, it gets stiffer for a second, and that allows you to keep going.
Yeah.
Now, the other I was going to say something. Oh, that this is one of those techniques that you start all sterile, then you become dirty sterile. When you suction a tracheostomy, it's the same. You prepare everything, you are sterile, but the moment you start messing up with the suction, the hand that you used to suction becomes dirty and the other one becomes sterile. Okay?